Good morning, everyone. Welcome to Assembly Judiciary. Welcome to those watching in Las Vegas as well as anyone watching online. With that, Secretary, please take the roll.
Assemblywoman Bilbray Axelrod. Assemblywoman Cohen. Assemblywoman Considine. Assemblywoman Gallant. Assemblyman Gray. Assemblywoman Hanson. Assemblywoman Hardy. Assemblywoman LaRue Hatch. Assemblywoman Marzola. Assemblywoman Mosca. Assemblywoman Newby. Assemblyman Orentlicker. Assemblywoman Summers Armstrong. Assemblyman Urick. Chair Miller.
Here. And please mark Assemblywoman LaRue Hatch absent excused, and Assemblywoman Gallant is present. She will be back in a few moments. With that, we will go ahead and get started. Just a few reminders. Please turn off any of your electric devices so that we don't have anything disrupting the hearings. Also, we will have public comment at the end of today's meeting where everyone will have up to 2 minutes to make a comment about anything under the purview of this committee. We also ask, just as a friendly reminder, that when you are submitting materials for your presentation, make sure they get in by noon the day before, as well as making sure that any pictures or logos or anything like that, that it's free for that to meet the requirements of LCB and as well as any other accommodations. Today we have 2 bill hearings. We will take them in order. The first one is Assembly Bill 411, which will be presented by Mr. William Horn, a veteran of this committee and this assembly, and of course require certain medical facilities to allow certain patients who are terminally ill to engage in the medical use of cannabis at the medical facility. And Mr. Horn, will you also please introduce your co-presenter, and then when you are both ready, please proceed.
Thank you, Madam Chair. Members of the committee, for the record, my name is William Horn with Strategies 360, representing our client Coalition for Patients' Rights. To my right is Mr. James Creel, who heads up the organization. He will be making primarily the presentation on Ryan's laws, what we call AB 411, which also passed in California. Unfortunately, the PowerPoint is not available, but we will, if it has not already been distributed to members, we'll get it to the members to see and go through it themselves. I will primarily be walking the members through the sections of the bill, what they do. And if it's with your permission, Madam Chair, I'll turn it over to Mr. Creel.
Good morning, and thank you, Madam Chair, honorable committee members. Thank you for the opportunity to present to you on AB 411, what we call Ryan's Law. Ryan Bartell was a special needs teacher. He was an instrumental part of his community, and whenever he got pancreatic cancer, it took him very quickly. I related a lot to that because I too was in a similar situation, watching my father pass away at a similar age. With that, I am connected to Ryan in the sense that he was, in fact, one of our patients at Compassion Center, and that we did, unfortunately, have to watch him suffer in a hospital, even though that hospital was well aware of his recommendation from the doctors and all of the various specialists that were in his continuum of care. With that, this bill does not allow hospitals to smoke, or hospitals to empower patients to smoke. This is strictly for edible, topical, suppository, and non-combustible routes of delivery. So it's really important to make sure that we delineate that because a lot of people associate medical cannabis with smoking. And while there's definitely a number of patients out there that do choose the smoking route of administration, the patients that we typically represent are categorically complex, terminally ill. They're passing away. They're in retirement and assisted living nursing homes. There's no way they could possibly smoke. With that, It doesn't give anyone the ability to have any excessive amounts in the hospital, just enough to be able to consume, to be able to mitigate their symptoms. And it also does not put the hospital in any form of liability because we've gone above and beyond and already gotten the Center for Medicare and Medicaid Services to sign off on hospitals' participation in this particular program. With that, we would like to work with Nevada to set that program up to serve your patients, because while Nevada's got a very diverse and very, very healthy healthcare system with only 14% of your state uninsured, we'd like to target and help those that aren't currently being served. And with that, I'd like to turn it back over to William.
For the record, William Horn. At this time, Madam Chair, I can go through the sections of the bill. In Section 2, subsection 1, it holds where what the patients are required to have and be able to utilize cannabis in a medical facility care, and that's a valid registry identifications or letter of approval, and also be diagnosed as terminally ill. Further down, as Mr. Creel had mentioned in subsection 3, is the prohibition against inhalations. That means smoking or vaping. Those type of deliveries would not be permitted in this, strictly edibles, topicals, suppositories, etc. In subsection 5, it doesn't require these facilities to comply, or these medical facilities to comply, in order to renew for their licensing. Or this is not some type of litmus they'd have to comply with in order to maintain their license for their medical facilities. Section 3 outlines the exemptions for hospitals, and basically these exemptions are if the United States Department of Justice, the Centers for Medicare and Medicaid Services, or United States Department of Health and Human Services initiate enforcement actions or adopts provisions expressly prohibiting hospitals from doing this, et cetera, they would be exempt from allowing patients to do that. And these exemptions would expire once these Department of Justice, Center for Medicare and Medicaid, and Health and Human Services receive notifications from these agencies as described in subsection 1. And if there are no further questions, or if there are no questions.
Thank you, Mr. Horn. I don't see any questions yet, but I do imagine there will be a few. I know I have a few, but I want to give members an opportunity first.
My brain thought, Madam Chair.
Okay, sure. We will begin with Assemblyman Urick.
Thank you, Chair, and thanks for the presentation. Can you give us an idea of how, like, for example, in California where this passed, how aggressive is the DOJ being at going after and trying to stop this sort of stuff? Are we seeing that they're pretty heavily involved, or do we think that they've been kind of backing off the enforcement of this?
Thank you, Committee Member Urick. James Creel for the record. We haven't heard of any enforcement actions as of yet, but the adoption and the rollout in California has also not been as aggressive. We're still educating a lot of doctors. We did set up an AMA accredited education program to be able to empower those providers. And so everything's still slowly rolling out. There are still some hospitals that have yet to fully implement and adopt the program, while others are open to it because it's been such a part of their culture for the past 25 years.
Thank you. Our next question will be from Assemblyman Orntlicher.
Thank you, Chair, and thank you for bringing this bill. I have a question about Section 2, subsection 5, on the top of page 3. And this is where facilities not required to comply with the this bill as a condition for issuance or renewal of a license. So what if some agency wants to take a less severe sanction? Does that leave them open? They have to renew the license, but could they impose some other sanction short of denying a license?
For the record, William Horn, just for clarification, sorry, Madam Chair, may it go directly to the
Please go
member?
direct, yes.
Thank you. Assemblyman Orlicker, for clarification, are you asking about sanctions that would be imposed federally against the facility, or?
No, say a state
state-
agency wanted to fine them rather than, you can keep your license, but we're going to fine you. Could they do that? And is that your intent?
That is not the intent in this legislation, and nor does the language, I think, give the state that power to impose such a sanction, sans adopting this policy of allowing patients to use cannabis. I don't think it's the language that's there.
Proceed.
Yeah. Well, the reason why I worry is if you say they can't deny a license, that suggests that they have power to take action on the basis of this. So why wouldn't you exclude other sanctions?
For the record, William Horn, I believe that the purpose was to give comfort to mental facilities to feel like they weren't hamstrung in complying with a policy they may have not agreed with or want to implement without fear of being punished by the state or Fed for making such a decision on doing that. And so I think that language is just is simply to do that. If the language needs massaging, don't have a problem with doing that, showing that.
And just to clarify, Mr. Horn, doesn't the legislation in itself, in fact, protect those facilities from being fined? Obviously, it's permissive and gives a facility the opportunity to decline to offer it, but wouldn't it, in fact, the actual legislation protect facilities that do choose to do it?
I believe so. I don't believe there's any mandate in this language that a facility has to do that.
Okay,
Madam Chair.
thank you. Our next question is from Assemblywoman Considine.
Thank you, Madam Chair, and thank you for bringing this bill. I'm in the same area as my colleague. That would be Section 2, subsection 2. I know it says that develop and disseminate written guidelines for engaging at the medical facility, but in a practical sense, if this is already being done, how is it being done if there is a patient in a facility that is controlling their own cannabis consumption? Is there communication with the rest of the staff who's balancing everything? I mean, how is it practically being done between the patient and the facility?
For the record, James Creel, and thank you so much, Assembly. So what in healthcare is what's known as a continuum of care and continuity of care. And in the medical records, your provider has a list of all of the prescriptions and the recommendations that you're on. And so in this case, it would be treated just like any other prescription or pharmaceutical that you're on. The hospital would still track its dosing. They would still chart everything. They just wouldn't be required to provide it like they are their prescriptions or their opioids or their pharmaceuticals. That's the only difference. It still provides the full tracking, the full integration, so they can properly manage what's known as contraindications, the reactions between the different drugs, but they don't have to provide it. So it gives them a certain veil, while at the same token giving the patients the ability to choose. And thank you.
Thank you. Our next question is from Assemblywoman Mosca.
Thank you, Chair, and thank you for this. Similar under Section 2E, 1 and 2, just for the record to make sure I know that for cannabis you have to be over 21. So for people who are working in the facility, how does that work in case they're under 21?
And thank you very much. Assemblyman Amaska. So under 21, if you are a card holder or a registry card holder, you are permitted to utilize the cannabis. But for employees of the facility, they wouldn't be coming in contact with the meds to begin with because the administration of the meds is still left into the hands of the patient and the caregivers that are within the room. So it's not like you're going to have a hospital staff member come in contact with those meds during that time. This just provides them with the ability to dose and administer it while in what's known as inpatient care. Thank you.
I would just like to clarify, Assemblywoman, you were asking specifically about the staffer, correct? So would you like to clarify that again and re-ask your question?
Thank you, Chair. Yes, just making sure that someone who is under 21 on staff would not have availability to be in contact.
Thank you. And James Creel, to clarify again, so the meds are being distributed by the patients themselves or the patient's family members that are already within their continuum of care. So there's no staff coming in contact with the meds other than the patient or the caregiver telling the staff, hey, they just took another suppository or they just took another route of tincture under the tongue or whatever that happens to be. The staff doesn't come in contact with the cannabis, so there shouldn't be any issues as far as age goes with that, unless I'm mistaken, but thank you.
And you're welcome. I'd like to follow up and clarify on that as well. I believe this Assemblywoman is asking because in cases, if you recall, most of us had part-time jobs as kids, right? And oftentimes that was as a cashier, and oftentimes if it was in a facility that sold alcohol and we weren't 21 yet, we couldn't even ring up that purchase. We would have to have someone else who was 21 come ring that alcohol through our register. So I think that's also, just want to make sure that it's not so much they wouldn't have access to the cannabis, but that they would be protected professionally, because again, we do have younger people working in as CNAs and stuff like that. So I believe is that correct, Assemblywoman? Yes, just making sure that they're protected professionally as well.
Yes, and Madam Chair, if I may, for the record, William Horn, in Section 2, subsection 2C, there's that requirement that the patients to store any of the cannabis or cannabis products in a locked container. That too will aid in keeping it away from those who are not authorized to be around it, under 21, et cetera.
Thank you for that. Our next question is from Assemblywoman Bilbray Axelrod. Oh, okay. Next question is from Assemblywoman Cohen.
Thank you, Chair, and thank you for the presentation. My question is actually about that locked box. I very much appreciate the bill because I do want people who are terminally ill to have as easy a passing as possible. But that lockbox can be easily stolen, and it's just a box. So how do we ensure? And we've heard about the black market this session in this committee. How do we ensure that just because it's in a locked box, that the box isn't just taken and the lock isn't jimmied open, that type of thing, to get to the product inside?
Thank you very much, Assemblywoman Cohen. And James Creel, for the record. We've been working with medical institutions, hospitals, and hospice centers to affix the lockbox in the room, just like they would any safe, that provides the box the security that you're seeking to prevent people from taking it. So it's become a little bit of a burden, I admit, because facilities are like, well, then we have to have all lock boxes in all these different rooms. But if you're really looking at it on a statistic level, how many patients do you serve that have medical cannabis that they use? It's a very small amount. So having a few rooms with lock boxes that you can assign and put patients in solves that problem versus having to put lock boxes across all the rooms. And it's a very small, very, very small expense for the organization to be able to meet their continuum of care.
Okay,
Thank you.
thank you. And can I have a second?
Sure.
Okay, thank you. And then my second question is about the medical card. If you go, so if the patient doesn't already have a medical card before they go, or the letter, before they go into the facility, can they get the medical card or letter while they're in the facility?
James Creel for the record, and thank you so much. What a great question, Assemblywoman Cohen. Yes, they can get the card or the recommendation after the facility. The difference between this law and the current law that you have in place for your medical cannabis program is currently, in order to qualify, you have to register with the program and have your card. This will give patients the ability, if they're terminal and they're in the facility, to be able to utilize a letter of recommendation instead of having to go through that card process, because that card process might take longer than they have left to live.
Okay, thank you. Thank you, Chair.
You're welcome. Next question from Assemblywoman Newby.
Thank you, Madam Chairwoman. And I echo the comments of my colleague in wanting patients to experience a comfortable as possible passing. But I do have concerns in Section 1 with the language using the word shall. And so I'm wondering if it seems like maybe some hospitals would have some concerns with this. If this is something, I'm curious why you made it shall versus may, and allowing facilities like your own who is interested in it to opt in, and facilities who might be opposed to it to not opt in.
Thank you very much, Assemblywoman Newby, and esteemed committee members. My name is James Creel, for the record, and I agree that organizations should have some choice. I really do. But the fact is whenever you give an organization an ability not to implement something, most of the time they don't do it because they don't want to take the time to have to train their entire staff on how to manage something that they're not familiar with. I too was in the same thing whenever I came to work with Compassion Center, and I got to tell you, it's been an interesting run learning the complexities of all these different laws from state to state, because there's such a patchwork, and we work in so many states around the country. So I can definitely understand where you would want that. However, in our world, whenever a patient's suffering and they're dying, you're obligated to provide them the comfort and the care that they need at the end of life. And whenever you've seen what this can do, you kind of feel obligated to make sure everyone has that access and not just a limited few people who decide to implement a law over who decides not to. And so that's why I would hope that the committee would keep the word shall and not change it to may. With that, thank you.
Our next question is from Assemblywoman Considine.
Thank you, Madam Chair. I had sort of a follow-up question to a much earlier question. We have hundreds of thousands of veterans in this state, and we have a VA hospital in this state. And I know that a sort of a question about enforcement was asked, but is there a VA hospital? Is there a VA hospital anywhere else that this is available, that patients can avail themselves of this law, or do you know if the patients in the VA hospital in Nevada would be able to?
Thank you very much. That is a wonderful question. And yes, James Creel for the record, yes, there are VAs in the United States that are allowing their patients to utilize cannabis, but not just in the hospitals. So for many years, the VAs have said that if you're in a state that authorizes medical cannabis and you're not engaging in behavior that's going to compromise your safety with your other meds, with your continuum of care, then they've taken a hands-off approach on that. We've been working with the VA in Oregon specifically since about 2004. We have been working with the Roseburg unit to work with not just the addiction and the mental health side of things, but also for the palliative and the end of life. And so I'm really grateful that you're looking at that. And the VA and the federal government is definitely looking at adopting a similar model across their spectrum as well. Thank you.
And just to follow up, do you have a list of those states where it's being utilized? For the VA, for veterans?
James Creel for the record. I can do my best to get that list for you.
We would appreciate that. Thank you so much.
Thank you.
I actually have a few questions as well. And I obviously understand because of federal restrictions why we can't allow doctors to prescribe this or facilities to facilitate this, which either the irony or the hypocrisy is, my mother is a retired RN, and when she first became a nurse, she worked in a nursing home, and she would tell us about the patients who were prescribed one beer or one shot of something a day. I see the heads nodding, right? The heads are nodding. And yet we're still struggling with what we know has a lot of value, a lot of medicinal value. I even think of my own grandmother who died 20 years ago from Alzheimer's and dementia. And at the time, all of the anti-anxiety and anti-psychotic and anti-everything drugs that we attempted that made things much worse and worse and worse. And years later, I had just said, Ma, if we had just given her some weed, she just, just calm and sleep. And that would have been tremendous for her. I think of my other friend, you say pancreatic cancer, the same thing, 20 years ago before these discussions even happened. And he had been type 1 diabetic his whole life and had transplants and the whole thing. And he decided one day to start smoking weed. And his mom says, what do you think about him smoking weed? That's horrible because he's barely hanging on. And of course, in my limited experience, I said, well, I know it'll make you eat and sleep. And I think that's the best thing for anyone, right? When you're healing. And so she went and they asked his doctor. And again, this is 20 years ago. And the doctor said, yeah, that's literally what we need him to do is eat and sleep. So we know if at the minimum, it helps people to just relax and to eat. That's a minimum. I guess my first question is, why is this only available for those who are terminally ill? Because the term terminally ill I'm not sure if there's a specific definition of you have this many weeks or this many months, or you're just never gonna recover. But we have people who are enduring and suffering and surviving a number of things where cannabis can also assist with their livelihood or healing. So I'm just wondering, and I'm not trying to imply that cannabis heals, but we know what I'm saying, resting, peace, eating, those types of things that our bodies actually need in order to heal. Why is this limited to terminally ill?
Thank you very much, Madam Chairwoman Miller. James Creel for the record. So straight up, it's easier to get committees like yours to want to help terminally ill people than it is to help the masses, because whenever it's terminally ill, everybody's got a connection to someone they've been forced to watch suffer and die. Whenever it comes to people being sick, everybody knows someone who's sick. So it's a lot easier for someone to say, everyone's sick, deal with it, versus everyone is going to die at some point. Wouldn't you want to die with some compassion and dignity? And so I guess while I agree with you, it is hypocritical of us to submit a bill to you for just terminally ill people. However, it's a start. They are the ones that could benefit the most from the relief that we can provide them from it. And at the same time, it will allow the hospital systems to understand that it's easier to implement than they had originally thought. And it will also allow the law enforcement bodies, the government agencies that are regulating it, the time and the energy and the effort to slowly integrate it versus everyone having to just figure out how to do it. We've been working on codifying it since 2010. You mentioned earlier about prescribing it. In Oregon, we actually did get it rescheduled to Schedule II with the Board of Pharmacy at one point, and doctors could prescribe it. The problem with it is it all revolves around doctors and what we call prescribing practitioners trying to fall within the guidelines of their DEA obligations. And we don't want to bring anybody's credentials into the line of fire, period. Not the hospital, not the provider, not the caregiver, nobody. We want everyone to be able to thrive and everyone to be able to live a life full of dignity and compassion legally. With that, James Creel.
Thank you for that. Additionally, is there any, when you structured this, is this modeled after other states that you have attempted or passed this in?
James Creel for the record. Yes, ma'am. From what I understand, it's identical to California with slight tweaks for Nevada, but yes, ma'am.
Thank you. We always appreciate hearing slight tweaks for Nevada. We always like to, if we're using sample legislation, make it work for Nevada. So I appreciate that.
Nevada's where it's about.
Thank you. Thank you. Not seeing any other questions at this time, I will go ahead and open it up for testimony. For anyone here in Carson City that would like to come forward to support Assembly Bill 411. Is there anyone in Las Vegas that would like to support us, testify in support of Assembly Bill 411? Okay, broadcasting, open the lines for anyone that would like to testify in support of 411.
To testify in support of Assembly Bill 411, please press *9 now to take your place in the queue. Caller with the last 3 digits 041, you are unmuted and may begin.
Hello, this is Cindy Brown in Las Vegas. I happen to be one of those people that maybe end up in the hospital terminally ill. I am currently dealing with breast cancer that doesn't seem to want to go away. And I would love for you guys to pass this bill. I was too exhausted to get out of bed and come down at this early hour today. Please, please pass this bill. Thank you.
Thank you so much for your testimony. Next caller.
There are no other callers choosing to testify in support at this time.
Okay, thank you. With that, do we have anyone that would like to testify in opposition of 411 here in Carson City?
Good morning, members of the committee. My name's Patrick Kelly. I'm the CEO of the Nevada Hospital Association. We're concerned about the legality of AB 411 under federal law. In U.S. versus McIntosh, the Ninth Circuit Court of Appeals, which we are under their jurisdiction, stated that anyone in any state who possesses, distributes, or manufactures marijuana for medical or recreational purposes or attempts or conspires to do so is committing a federal crime. Now that was cited in a letter from the U.S. Department of Justice to the California Hospital Association when they asked about this situation. My reading of the bill does not protect healthcare providers. What I see it saying is that if CMS issues a bulletin that says, you can't do this, then it says then hospitals don't have to follow it. But the problem is you can still be prosecuted because you've committed a crime. I don't see anything that keeps the U.S. Attorney's Office or any agency like that from prosecuting a healthcare provider. So what you're asking people to do is be the test case in a prosecution. And so we have great concerns about that. I don't think it's fair to the people who work in a healthcare facility. We have compassion for the people who are terminally ill, but it's not fair to put somebody in a position where they could lose their license to be a pharmacist or a doctor, or the hospital to lose its DEA standing, all sorts of things. The second thing I want to talk about is the fact that acute care hospitals aren't the most appropriate setting for this. I can understand why you'd say long-term care facility or hospice, because those are residentials. They're supposed to be like the patient's residence. But when you go to an acute care facility, it's usually because there's an acute event that has occurred. So we started administering drugs to address and provide treatment, and those drugs might not interact as well with the medical cannabis. And we don't know the strength of the medical cannabis the patient's being provided or how frequently they're taking it when it's brought into the facility. So there could be an adverse effect that we just won't be aware of. It could be as simple as somebody who's used to taking so much medical cannabis all of a sudden has a new drug in their system, and they get up and go to the bathroom and they just fall because the interaction, they're not used to it. So we think that there's a lot of concerns with this bill. So we would be happy to work with anybody on the committee who wants to work on this, but I would just caution that I would love for California to be the test case and find out whether the federal government's going to do anything. And we know politics change. While it might be acceptable at this, there could be another election where all of a sudden you have a zealous prosecutor who comes in and decides this is going to be their issue, and we're the test case. Thank you.
Thank you, and I would add, please work with the bill sponsor as well.
May I ask who that is? Because it just says it's the Judiciary Committee's bill.
It is, so you can work with us, but also with Mr. Horn.
Okay,
Yeah.
thank you.
Thank you so much.
Good morning, committee. My name is Jeff Rogan, and on behalf of Clark County, we concur with the previous statements of the NHA. Thank you.
Thank you. Is there anyone else here in Carson City in opposition? Not seeing any. Is there anyone there in Las Vegas in opposition? Not seeing anyone. Broadcasting, will you please open the lines?
To testify in opposition of Assembly Bill 411, please press star 9 now to take your place in the queue. Caller with the last 3 digits 100, please press star 6 to unmute your phone.
Good morning. For the record, my name is Adam Porath, A-D-A-M-P as in Paul, O-R-A-T-H. I'm the Vice President of Pharmacy at Renown Health in Reno, and today I'm representing both Renown Health and the Nevada Society of Health System Pharmacists. I've been a practicing hospital pharmacist in Nevada since 2006. I'm here today in opposition to AB 411. Unfortunately, this bill represents a good concept theory, but creates regulatory challenges and patient safety issues in the real world of acute care practice. It was mentioned by the bill sponsor that CMS may have signed off on this concept. However, medical facilities that have pharmacies, like acute care hospitals, are required to be registered with the Drug Enforcement Agency in order to be able to acquire controlled substances that are not only necessary for adequate pain control for hospitalized patients, but also necessary for everyday inpatient and outpatient surgeries and procedures. Allowing a patient to utilize patient-acquired medical cannabis while in the hospital could potentially put our ability to acquire essential medications to patient care at risk. In Section 3, this bill acknowledges the federal status of cannabis as Schedule 1, yet states that a facility cannot use this status as a basis for not allowing the use of medical cannabis in their facility. Additionally, there are already FDA-approved prescription oral forms of both THC and CBD, known as Marinol and Epidiolex, that can be legally prescribed and administered for patients in medical facilities without a medical card today in Nevada that allow patients access to multimodal pain control, including cannabis-based therapies. The utilization of these formulations, rather than dispensary-acquired products, allows hospitals to maintain our patient safety mechanisms like bedside barcoding, and allow for evaluation and management of the real potential for drug-drug interactions between cannabis-based products and other medications that we would likely be administering to terminally ill patients while they're in the hospital. Terminally ill patients should have access to all available evidence-based therapies. We can provide cannabis-based therapies in medical facilities today with FDA-approved products that do not potentially put medical facilities in Nevada at risk for sanction by the federal government. For these reasons, we cannot support AB 411 as currently written. We welcome the opportunity to sit down with the bill sponsors to discuss further to see if we can come up with mutually agreeable language. I thank you for your time today.
Sir, are you still there?
I am.
I would like to ask you a question if you don't mind.
Sure.
Okay, so when you say derivatives, and that's always an interesting term for me because I know that many of the prescriptions that are used and prescribed are derivatives, or their derivatives can also be found on the street. So we can all make those connections when it comes to derivatives. But when you're talking about a derivative of cannabis, and I will mess up the term if I try to say it again, but could you just, if you're saying that there is a derivative, it is available, it can be prescribed, can you tell us how often and in which medical cases that it is currently being prescribed here in Nevada? And I know you may not have that exact, but just kind of anecdotally, maybe in your experience.
Yeah, so the prescription product that contains, again, sorry, for the record, Adam Forrest, Vice President of Pharmacy at Renown Health. The prescription THC product is known as, the brand name is Marinol. That's been on the market in the United States since 1985. It was originally approved for HIV-induced cachexia, which is basically, the wasting away associated with HIV. It has since been approved for a number of other disease states, including cancer and others. And then there's a separate product that is pure CBD that is under the trade name as Epidiolex. And that was originally approved in the United States for seizure control, and has since it's been studied in many other disease states. So these are synthetic forms of the active ingredients of cannabis that are available today.
Thank you. And my question was also, do you know how often it is prescribed?
Well, we regularly keep it in inventory at our hospital pharmacy, the Marinol. So it's not infrequently prescribed, but I couldn't give you an exact how often.
Could you do you maybe have an assumption on which types of patients or conditions it would be prescribed to, if and when it is prescribed?
Yeah, typically terminally ill patients for the THC product.
Okay. Thank you so much. Thank you. I appreciate that.
Sure.
Next caller.
There are no other callers choosing to testify in opposition at this time.
Thank you so much. Then I will go ahead and open it up for neutral testimony here in Carson City.
Good morning. Barry Cole, B-A-R-R-Y-C-O-L-E. I wish this bill could have been 9 numbers later, and then it could have been Bill 420. How ironic that would have been. I want to let you know, as a psychiatrist, a neurologist, and an anesthesia fellowship-trained pain specialist who's taking care of 300 people at St. Mary's Hospice from admission to hospice to the day and moment of death, that cannabis has been part of medicine since God was a corporal. I know people were eating brownies. I know people were eating cookies. I just didn't do anything about it. We have Marinol. You already heard about it. I've prescribed it before. So we have Delta-9 THC as a prescription product that comes right out of the pharmacy, goes into the patient's medication cassette, and is administered by the staff. Yes, your mother really did give shots and beer to people, because 12 ounces of beer, 4 ounces of wine, 1 ounce of whiskey is the analgesic equivalency of 11 milligrams of injectable morphine. A surgical patient gets 10 to 15 of morphine every 3 to 4 hours after surgery. So this isn't like new science. This is just sort of rectifying and I guess making it a little less onerous within the hospital environment. I've never had to worry about cannabis medication cards. I've never worried about what that means. In fact, I've been forbidden in some environments to issue them myself, even though I brought up ADA challenges, like how do I deny them? But that's how some systems work. We can get these products to people with or without this legislation. I understand the intent would be to sort of clarify so that the feds can't come in secondarily, but right now I see no indication that the federal government is concerned any longer about cannabis. They've got fentanyl and carfentanil to worry about. We have serious problems. This is kind of like low level. I think we can work this out. And terminally ill people, give them anything they want. And I'll even go out on a limb and say, include in that mushrooms and MDMA. I mean, what else? It's not going to hurt them when you're terminally ill. People should die comfortably. And I like to say 95% of my people died very comfortably. And for the 5%, that was terminal sedation. We have ways to make the last few days pass in a fog. And that helps everybody, patients and family included. Thanks.
Thank you. With that, is there anyone here that would like, anyone else here that would like to testify in neutral? Is there anyone there in Las Vegas that would like to testify in neutral? Broadcasting, is there anyone on the line that would like to testify in neutral?
To testify neutral to Assembly Bill 411, please press star 9 now to take your place in the queue.
Hi, this is Cindy Brown again. On the neutral, I would
Okay,
like to,
Ms. Brown, did you already testify in support?
I did, and then a couple of things were brought up that I thought should be addressed by a person who is actually sick.
Okay, but I have to ask you, are you changing your testimony? Because the rules of the
No.
Okay, then I will ask you to please submit your comments. You can email us or submit it in writing, but we are.
Okay.
Okay? Thank you so
Okay,
much.
I will do that. Thank you.
Thank you.
Bye.
Is there anyone else in broadcasting that wants to testify in neutral?
There are no other callers choosing to testify in neutral at this time.
Okay, thank you. Then with that, I will welcome Mr. Horn back up for any final remarks on the bill.
Thank you, Madam Chair, members of the committee, for your time and great questions on AB 411. I will, before turn it over to Mr. Creel, was reminded that listening to the opposition on this, I recall some of those same calls of that the feds were coming in 2013 when we legalized and put into place regulations for medical marijuana in our state. There were concerns about the feds coming in and taking licenses and et cetera. And it was a process we all worked through and getting there. And as you can see, we've pretty much gotten there. Today, 10 years later, not only we have a robust regulatory system in dealing with cannabis, and it's still a work in progress, but it's working for the most part. And this is not going to be any different. It was mentioned that, likely low-lying fruit as what the feds, the DOJ is looking at enforcing, et cetera. And I believe that to be the case, particularly this narrow focus on terminally ill patients. Also, the pharmacies are not required to do any dispensing on this. And this is, a patient choice at the end of their life, which, you know, I dealt with my mother just a few years ago. And she also asked me to bring her gummies. You know, that in addition to her church's, you know, her Popeye's chicken, which for a long time I would deny her, but at some point I allowed it in doing so. So I would leave that with the committee to ponder on. Mr. Creel.
And thank you. And for the record, James Creel. Very great questions and very, very valid concerns. To our knowledge, in the past year and 4 months that Ryan's Law has been in effect in California, no hospital has been even bothered by it. To our knowledge. I'm not saying it's not going to happen. If you really look at it systemically, if a regulator is going in and they're looking for a problem, if there's a problem, chances are they're going to find it. And just like with any regulatory body, if you do find problems, there's going to be fines. But that shouldn't penalize those that are properly and compliantly operating within the system. Another thing I want to bring up, and I really want to thank Adam from Renown for his testimony, because those are also very valid points. Let's discuss Marinol for a moment. Dronabinol. Dronabinol is the generic name for Marinol. It's been available for a long time. It is a synthetic version of THC, one of over 140 compounds that have been proven to be beneficial to your body's endocannabinoid system. And if you want to look up something and go down a rabbit hole, the entourage effect or the ensemble effect. It has been proven multiple times over that one single isolated derivative, cannabinoid, is not going to be efficacious in meeting your needs. You need the whole spectrum. And so with that, Epidiolex, GW Pharmaceuticals went through all this work to get Epidiolex scheduled. And if you look, a lot of states don't even have it scheduled anymore because none of the pharmacies wanted to pay the amount of money necessary to hold it in inventory, much less the patients pay the money to get it. Whenever you can go downtown and you can purchase CBD in a smoke shop, that's the essential equivalent of what they're charging thousands of dollars for, no one's going to do it. And so patients shouldn't be forced, and the patient's family shouldn't be forced to pay these exorbitant amounts for these scheduled products whenever they're not getting what they want, whenever everything's available in this robust regulatory environment that we've created for them in recreational. And so there's a lot of stuff in there that they can get their hands on that could also cause problems. And I don't think that cannabis should be singled out as one of those things. There's plenty of education on contraindications. We have actually provided CME to UNR, which is the parent organization, I believe, for Renown. And they understand contraindications on medical cannabis a lot better than others because of their intimate knowledge of that CME. So if there are any questions, I'd be more than open to help guide you in the direction of quantifiable research for that. And if not, I'm at your service. James Creel.
Thank you so much for that. And with that offer, please expect that members may reach out to you. So thank you so much for that. Or in reality, reach out to Mr. Horn to get your contact information that way. Thank you so much. With that, I will go ahead and close the hearing on AB 411. Our next bill today is AB 413. So I will now open the hearing on AB 413, which is presented by Chris Anderson. And this measure revises provisions relating to cannabis. Mr. Anderson, are you presenting on your own? Or I also see Bob Whitley. Is that who is in Las Vegas?
Yes, Mr. Whiteley is my co-presenter via video conference at Grant Sawyer.
Okay, Mr. Whiteley. And who is that? Mr. Anderson, I'm going to ask you to, I really need to do this with everyone, but I always forget. I'm going to ask you to move over one seat because I cannot see, and you probably can't see me, and it's just, yeah. Thank you. I like to be able to see. That's why you always see me kind of doing this, because I can't. Much better. Who is with Mr. Whiteley down there?
My partner, Eva Black, I believe.
Oh, okay. So, and Ms. Black will also be part of the presentation?
I believe she's there to assist Mr. Whiteley with any technical or reference questions he has.
Perfect. So with that, the hearing is officially open. Just one last question. Will you be presenting off of this amendment that we just received?
Yes, I will be.
Awesome. Thank you so much. Please begin when you're ready.
Thank you, and I feel like this slide that's been up on the big screen for a long time is kind of stealing my thunder. It tells a lot of the story.
We haven't even noticed it, I promise.
But nonetheless, thank you, Chair Miller. Thank you, members of the committee. For the record, Chris Anderson presenting on behalf of Sala Consulting and our clients Planet 13 Holdings, Hardin Premium Cannabis Dispensary, and R&BW. I'm pleased to present Assembly Bill 413 as amended by our firm. Nevada is struggling to combat a large and dangerous unlicensed cannabis industry. Many of you have heard this through your personal circles and in testimony this legislative session. Nearly 6 years after Nevada's first adult use dispensaries opened, the unlicensed industry is alive and well. Our nearly $1 billion a year legal industry is competing with an equally large illegal market. Indeed, all estimates point to illegal sales making up at least half of the total cannabis market. As a result, the state of Nevada is losing literally hundreds of millions of dollars in tax revenue every year. Illegal operators prey on unsuspecting tourists who may not realize they're purchasing dangerous, untested products. Children easily access such products and sometimes require medical attention after suffering adverse reactions, including, you have a colleague here, Assemblywoman LaRue Hatch, who has firsthand knowledge of children being harmed at school and requiring medical attention. Recently, a couple years ago, thousands of consumers were injured by illegal cannabis vapes that contained harmful filler chemicals. According to the U.S. Centers for Disease Control, CDC, dozens of Americans died from those tainted vape products. The bill I'm presenting today is designed to efficiently and effectively fight back against this threat to Nevada's tourist economy, our homegrown legal industry, and our public health. The legislation before you is efficient in that it focuses one agency, the Cannabis Compliance Board, on taking the lead on enforcement of the unlicensed cannabis industry, a natural fit given the agency's experience with licensees and legal cannabis products. This is a civil enforcement approach that can be executed parallel to traditional law enforcement activities, meaning that this enforcement regime will not add to the burden on our existing law enforcement professionals, legal system, or correction system. AB 413 is also cost efficient. The CCB, if it chooses, can designate existing and additional inspection agents to identify illegal operators, as opposed to solely deploying post-certified law enforcement agents. Lastly, the efficacy of this legislation is enhanced through multi-pronged enforcement tactics. This bill creates a whistleblower program within the CCB to deputize and incentivize consumers, advertising platforms, billboard owners, and landlords to help identify and refuse service to unlicensed cannabis operators. I believe that this legislation will allow us to achieve meaningful results without doubling down on the failed war on drugs and over-criminalization of the past. I'm excited at the prospect of putting this legislation into action for the benefit of all Nevadans. Now, I'd like to walk you through the bill as amended, followed by a presentation from my co-presenter, Bob Whiteley, to discuss the unlicensed cannabis landscape as revealed in the Nevada Cannabis Association's investigative report, which Mr. Whiteley co-authored. Moving to the bill as amended, Section 2 provides for penalties, civil penalties on internet websites or other advertising platforms for accepting paid ads that contain unlicensed cannabis operations. Section 2 allows civil penalties to be recovered by the Attorney General. The Attorney General, at the request of the Cannabis Compliance Board. It also provides for recovery of any excise taxes that normally would be paid through the licensed industry if it's proven that the quantity of unlicensed sales, we can charge back taxes for that. Moving on to Section 4, it requires the Cannabis Compliance Board to designate agents for investigation and enforcement of these laws, and also requires the board to publish on its website a portal for whistleblower tips, both named and unnamed submission of suspected violations. It also clarifies that the board, in its enforcement activities, may seize unlicensed cannabis or cannabis products, weapons, or currency associated with unlicensed operations. Section 6 amends the Cannabis Compliance Board's powers by explicitly allowing them to treat unlicensed cannabis investigations in much the same way that they treat investigations and enforcement actions against the licensed industry. It also requires the board to do an annual report to the Legislative Counsel Bureau to update you all on the status of enforcement actions and efficacy of those activities. Section 7 is the whistleblower section. Provides rewards to people who provide material information to the Cannabis Compliance Board that results in civil actions and the actual recovery of civil penalties. So folks, whistleblowers don't get paid unless the state gets paid. Section 8, this is to tighten up provisions that capture Delta 8, harmful Delta 8 THC products. So we're revising the definition of synthetic cannabinoid, which if you look at the Center for Disease Control, the CDC, they will tell you that synthetic cannabinoids are dangerous, have no positive use. So we're adding to the definition of synthetic cannabinoid any product that is not obtained directly from cannabis without the use of chemicals. And we're also providing some flexibility for the board to, by regulation, identify other artificial processes that create synthetic cannabinoids so that we can update that in between sessions if necessary. Section 9 provides for the increased maximum civil penalty for unlicensed cannabis operations. That new maximum is $10 million, except for if a illegal operator sells specifically by means of an in-person transaction of an ounce or less of cannabis products or the equivalent in concentrated cannabis. We're also, this section further clarifies that the board has those powers to regulate unlicensed operators in the same way as licensed operators. I wanted to be very clear about that. Moving on, we're skipping a couple pages that were deleted. So moving on to page 14 of the amendment, section 10 modifies the definition of marijuana to remove seeds. That's been removed in several other states' statutes. So that's just more of a housekeeping measure. And we're also clarifying that any commodity or product that exceeds the THC concentration of hemp is a marijuana product. So this is to get at like hot hemp, it's called colloquially. So basically, even if the ingredients are legal, if the end product is a THC product, it is a marijuana product. So it's just clarifying that. This is, again, something that will help the CCB fight Delta 8 products. Section 2 removes harvested root balls from the definition of marijuana because they're not viable THC products. And Section 11 has a small cleanup reference from LCB, and then Section 12 provides for effective dates of this measure. With that, I would like to turn over the presentation to my co-presenter, Bob Whiteley, to speak to the Nevada Cannabis Association's investigative report on Nevada illegal cannabis sales.
Good morning, members of the Assembly. Thanks for having me. My name is Robert Bob Whiteley. I am a licensed private investigator in the state of Nevada, retired Las Vegas Metropolitan Police Department Sergeant, retired 2 years ago. The report that I authored was co-authored by myself and another private investigator named William Schoen. We put this together, retained by the cannabis industry to determine what the impact of the unlicensed industry is in Nevada, and this is what we found. Illegal cannabis poses a threefold problem. The first one is public health crisis. When you look at that, you look at no age verification or product testing. So when we say health crisis, we say that any type of chemicals or adulterants can make it into the marijuana in the illegal market, and there is no regulation to stop that. Destabilizing threat in licensed cannabis industry. The more the unlicensed industry impacts the licensed industry, it could push that out to where we have a situation where it's only unlicensed industry. There's a massive loss of public revenue. Again, that money that is transferred in the unlicensed industry is not taxed, it's not accounted for, and it's not taxed on the state or federal level. They estimated that state biannual revenue loss is $614 million, and that is based on 50% of the total market in Nevada at a 31.65 tax rate on legal cannabis. So $614 million is quite a large number. So we found that there was several methods of distribution. The first one is going to be delivery dealers, and basically those are the ones that will bring the marijuana directly to you, the illicit marijuana directly to you, and you pay cash for those items. The second one that we found was through social media, and they work kind of hand in hand. Social media is where you would go on to find your dealers, and then either they promote the pop-up shops or they do delivery to your residence. The third one is, of course, the pop-up shops, and those are basically farmers markets for marijuana that pop up on a daily basis. And then the last method is unlicensed retail stores and street sales. So we actually have an example here in my presentation where we had a retail store that acted as a legitimate cannabis distribution store and did not have a license. And I believe it's still active today. And then you've got street sales, which are your sales that occur in the corridors of Fremont Street and Las Vegas Boulevard. When we talk about delivery dealers, I would estimate this is the largest source of distribution. It's dealers who deliver it directly to the client. Illegal distributors found through various methods, such as Craigslist. We found advertisements on Craigslist. When you look at the advertisement, it's not just marijuana that they were advertising. It was other illegal narcotics, such as cocaine, heroin, all that kind of stuff. It's basically just a grocery list of Schedule I illegal narcotics that they sell to include marijuana. One of the things we found was there was business cards that were distributed into a condominium complex at Canyon Willows, and the business card was distributed to 700 different units, which is not allowed in the industry. And I went online and I investigated the website that's linked to that business card, and I was able to put together a purchase all the way up to me actually buying the illegal product. When we talk about social media platforms, one of the places that you can go to is Instagram. I found numerous places on Instagram that advertise the sale of illegal cannabis. It's easy to find them. You just have to basically find one, and then they pretty much all link together, and you can start friending, and get numerous different sellers that are in the market. One example, that if you look towards the slides, it was a smoking bomb bud with the link to it, and the link sends you to another app called Telegram. And once you get to that app, it's more of a chat app, and basically they list all the products that they sell. The majority of it they claim is from California, and it's just all day long they're posting new product, new different types of forms of cannabis, from buds to vapes to edibles. I did a quick Instagram search. I found 7 accounts. The other method that we found were the pop-up shops, and those were quite prevalent even when I was on the department. In the unit I worked, we would investigate those, and we shut down several of them at the time that I was a sergeant on the Las Vegas Metropolitan Police Department. Basically what happens is a promoter rents a warehouse or industrial space, and they just hold illegal cannabis pop-up shops. And what they do is they rent tables out to anybody that wants to sell their product, and then they sell tickets to the door, and the public at large can come in, and it's just, like I said, it's like a farmer's market for marijuana. They can peruse and buy as much marijuana as they want. We found those pop-up shops through advertisements on Instagram. They make sure that they have security techniques that eliminate, potentially eliminate law enforcement from getting into those places. They basically have you communicate to them directly. They send you the address and location via direct message. And then once you get to the door, you have to show that you have an invitation to the pop-up shop. The other one is unlicensed retail stores and street sales. I actually went to a place called Exotic Clouds, which is off of Sunset Road, and it operates as a licensed retail facility. And you go in and you purchase Delta 8 vape pens, untested flower and edibles, and they did not have an age verification. We were able to purchase buds of marijuana or cannabis, and we had it tested, and it tested to be illegal marijuana. And then the last one would be street sales that we talked about, and that's mainly in the tourist corridors. And, I've been there myself where, when I was working for Metro, where I was solicited numerous times on the Las Vegas Strip and Fremont Strip to purchase marijuana. We've done setups where we purchased illegal marijuana and other narcotics on the Strip. And it's not the most prevalent form, but it's definitely out there. We talk about the effects of what this means, and it's a public health crisis. As Chris stated, there was in February 2020, there was 2,807 hospitalizations, 68 deaths according to the CDC. One of them was reported to tainted vape pens. The lack of age verification allows youth to easily obtain illegal cannabis products. One of the things that was most alarming to me was you see the packaging from these illegal sellers, and the packaging is made towards young kids in the form of Fruit Loops and Fruity Pebbles and various cereals and gummy worms, and basically the packaging looks exactly like the real product. And it's all marketed towards the younger audience, and it's a danger in the fact that if somebody underage that doesn't know any better gets a hold of it, it could be detrimental to their health. We talk about trafficking sources and where this illegal market's coming from. I would say the largest portion right now is California. I think it was back in 2020 and 2021, there was an overproduction in California between the legal and the illegal market. And so you saw a heavy influx of the product coming to Nevada to be sold. Nevada also has an illegal market that one estimate has doubled since 2016. In September 2021, law enforcement conducted a search in Gardnerville, Nevada, resulting in the seizure of illegal cannabis with a retail value of over $100 million. 87 individuals were detained, and not one was criminally prosecuted. The illegal cannabis sales are dangerous to youth and adult consumers. No age verification, no product testing for harmful chemicals, heavy metals, adulterants. One of the issues that in talking with HIDA was that there's a concern of cross-contamination. If you sell different products of cocaine, fentanyl, and you bring all those together with the marijuana, there's a great potential for cross-contaminations to occur, so even if it's not intentional, it still could happen. The illegal sales, estimated a minimum of 50% of all sales, continue to destabilize the Nevada licensed industry. One of the things that I also noticed was the illegal market coming from California is a lot cheaper than it would be to manufacture and sell in Nevada. So just from the economics alone, they can undercut the market by almost half, even more, through the unrestrained industry. And again, finally, the loss of the state revenue is estimated at $614 million. And that is it.
Is that the end of the presentation?
Yes, ma'am, I'm done.
Okay, thank you. So we will begin with questions. The first question is from Assemblywoman Summers Armstrong.
Thank you, Madam Chair. My first question, Mr. Anderson, is who's sitting at the table with you today?
Esther Badiata. She is a director with Sala Consulting.
Spell her last name, please.
B-
Ms. Badiata, can you please answer?
I can. Esther Badiata, last name spelled B as in boy, Adiata.
Thank you so much.
You're welcome.
We are a woman majority legislature, and we're not invisible. My question is, I get that this is an issue for you all. You made a statement earlier about we're not trying to redo the war on drugs, but these penalties seem extremely excessive to me, so I'm concerned about that. And I'm also wondering if your industry has done any significant marketing to tell the public that although cannabis is legal, that there are ways for them to find legal dealers to go to so that they are not fooled into going to illegal dealers. People don't know. They just know that it's legal in Nevada. So what are you all doing proactively to inform our visiting public where and who and how they can find legal dealers?
Chris Anderson for the record. Yeah, I think what you're referencing is kind of more or less a PSA campaign, which is traditionally more of a government function. I represent individual cannabis licensees. We represent individual cannabis licensees. So I can't speak for everyone in the industry or for associations in the industry. But I'm not aware of a PSA that's industry sponsored. I do know I was actually at a meeting at the Clark County Commission last week where the county has wheels in motion to initiate a PSA campaign. I think that would be a wonderful thing for the state to pursue as well.
Thank you, Mr. Anderson. That might be I understand your comment that this could be a government duty, but you're bringing a bill asking the government to protect your business interest, your income, but you don't believe that there is any responsibility for your industry to participate in this, because all the fines that would have to be imposed, hiring people to go and enforce, those are all at the responsibility of the government, but on behalf of licensees who are multi-million, if not billionaires. So I ask you, do you believe that you all have any responsibility to help inform the public on this issue?
Speaking on behalf of our clients, they're some of the largest advertisers in the industry. Particularly, I think if you live in Las Vegas or spend any time there, you've probably seen a lot of Hardeen's advertisements for their legal dispensary over on Desert Inn near Eastern. I think that there could be some appetite within the industry to, come together and help fund some sort of PSA. Again, personally, I believe that's more of a government function. Also, I don't think that this legislation is, solely focused on protecting business owners. I think this protects youth, protects adults from untested and harmful products. And it frankly protects the state's tax revenue, because I think the cost of not doing anything is far, far, far higher than the cost of doing something like what you see before you.
You're welcome. Thank you for that. Our next question is from Assemblywoman Cohen.
Thank you, Chair, and thank you for the presentation. I have a question. I want to make sure I understood what you had said about the CCB agents that are non-post certified, but they can, they're going to collect weapons. I was a bit concerned about that. They're going to be, right? Can you get a little more into that? Because I think I don't want non-post certified agents seizing weapons or anything like that.
Chris Anderson, for the record. Yes, thank you very much for the opportunity to expand on that piece of my opening remarks. So, I think the cost efficiencies of executing, a regime like an enforcement regime like this are in that the Cannabis Compliance Board can either, they have dozens of existing inspection agents that, today are just doing audits and inspections on legal licensees. I think that those folks could do a lot of the investigatory work on the unlicensed market in probably a cost-efficient way. And then, when it's time to go and make, some kind of a raid or a bust on a large unlicensed operation, I would absolutely envision the CCB bringing in their post-certified agents, which they have, I believe, 4 today. I think they've requested more in the budget this session. But absolutely leaning on law enforcement trained agents, either in tandem with the non-post-certified folks, or just the post-certified agents on their own, or with other agencies like Metro Police, which the Cannabis Compliance Board does today.
Okay, thank you. And then the facility, I believe near Sunset, that Mr. Whiteley said is still open, that's not legal. Why is that still open?
That's a good question. The photos that were on the presentation that you saw this morning, I screenshotted those from Yelp 3 or 4 days ago. And so it's there today. It's operating like a normal business. I know the folks at the county have tried to shut down that operation, I think through business licensing. For whatever reason, that hasn't worked yet. As a person who's not, in the enforcement side of things, I frankly don't know why that's still operating in the open, given that there's so much awareness of it, but it is still there. That's what I can tell you.
before we go to our next member, I would like to follow up on something the Assemblywoman said, going back to the question about the ability for enforcement officers or the board to seize weapons. I wrote it down when you said it because it struck me as well that you said they would be able to seize product, weapons, and money. And yet all throughout this amendment, we keep mentioning civil, civil, civil. Yet when we start confiscating products, weapons, and money, it no longer seems civil. And under where the board is able to, the board currently to administer fines for infractions and things like that that are happening, breaking policy and things like that that are currently happening. I guess I'm trying to see how, and it also seems like with this amendment too, that it's almost bringing the board up to the level of the Attorney General's office, because it's or the Attorney General or the Attorney General. And so I guess my question again, I would still like more clarification on, when we say or the Attorney General, who makes the decision of where the fines or would come from? Does the Attorney General say, we've got this? Or is this in addition? You have mentioned in tandem with Metro and such, but it also, please answer that one first.
Sure. Chris Anderson for the record. When it comes to seizures specifically, look, this policy, when I talk about, civil penalties, we're not talking about putting people in jail or putting people into the court system. So it's civil in that regard. I do think it's extremely important that even though this is a civil approach, we get dangerous products and the money that supports those products and those operations. I do think it's imperative that we get that off of the street immediately, and that's why the seizure provision is included. With regard to the Attorney General, there's some language in here that was actually added by LCB. It's kind of conforming language. But the way that this is envisioned, that today, so the way that it works with the Cannabis Compliance Board, if they investigate a licensee in the legal market, the investigator or auditor at the Cannabis Compliance Board will compile evidence and then send that to the Attorney General's office. They have DAGs assigned to the CCB to compile a formal complaint and detail evidence, and then the board then adjudicates that and levies the civil fine. And so I would anticipate that this would happen in the exact same manner.
Thank you. And we also really appreciate acronyms here. Could you define for everyone what a DAG is?
Deputy Attorney General.
Thank you so much. With that, we'll go to Assemblywoman Hanson.
Thank you, Madam Chair. Thank you for being here. It's good to see you. And I certainly know that you've worked hard by looking at this amendment to try to work it. And I do see a need for this, especially looking at the, granted, maybe there's still things that need to be worked out, but looking at the presentation, I was really stunned that 50% of all sales are illegal. That's a mind-blowing number, and that's a $614 million loss in taxes. So as you're going after this, help me to understand. What I took away is this legislation is looking to go after those in the advertising space. It's to try to recover taxes that we're not getting because of illicit sales, and protecting underage that aren't allowed to get it. In doing so, all I'm seeing is you're going after those who are, you're not going after those who buy it, you're going after those who are engaged in illicit sales, correct? That would normally fall under the compliance board. Therefore, we don't need law enforcement per se. The compliance board would then handle those, if I've got that. I just want to make sure I haven't gone off the trail here. Can you also maybe explain in the Delta, is it the Delta 8? I know there'd been some concerns. Can somebody address what are the kinds of things that we see when people have a bad experience with Delta 8? Why is that so dangerous and in need of our catching that as well?
Chris Anderson, for the record, and Delta 8 products are illegal in this state. They fall to some extent in a gray area federally. I would ask my co-presenter, Mr. Whiteley, you probably have a lot of experience in this space. Would you like to comment on that?
Robert Whiteley, I am basically, no, I do not have the expertise in Delta 8 to know what the adverse side effects are. I did not look into that as far as my investigation.
Chris Anderson, for the record, I can answer that question with kind of anecdotal things that have been, experiences that have been relayed to me. I think it's kind of a lot of times like a sort of a bad trip. It's like anxiety, kind of cold sweats. You can get into a situation where you require medical attention, some kind of effects of overconsumption. A lot of times Delta 8 products are extremely high potency and concentrated. Since they're not part of the regulated market, they can be, any concentration that a manufacturer wants them to be. And they're sold, online. They're sold in illegal pop-up shops or, illegal retail locations.
Thank you. Our next question is from Assemblywoman Considine.
Thank you, Madam Chair. So I'm just trying to get this process through my head. So somebody contacts the compliance board and says, this entity, this business, this front, this pop-up is selling marijuana and they don't have a license. That information goes to the compliance board. The compliance board compiles that information, sends agents out to the location to bolster that information, or just turns it over to the Attorney General for a lawsuit or for a fine or whatever. If you could just go over that, please.
Chris Anderson, for the record, just like the Cannabis Compliance Board does with the legal market, once illegal operations are identified, I would expect that in every case, at least some level of investigator or one of the Cannabis Compliance Board's post-certified agents might go out and collect more evidence in person. Maybe make themselves known and make a seizure or something. Maybe not, at their discretion. But I would expect that as part of the board's investigation of an illegal operation, at some point there'll probably be some physical first-person contact.
Thank you. Okay, so I guess I have kind of two questions. So if they can potentially make a seizure, make a report, but it doesn't shut it down, so that's my first question. And then my second is because you did say that this is at their discretion, and then in Section 2, subsection 2A and B, it's at their own initiative or at the request of the board. There seems to be a lot of discretion here. Will this have a data component that will be a report saying, where the demographics of the people who were, I'm not sure, I can't say arrested, fined, whatever, fined or investigated, where those locations are, or something to show that discretion isn't abused?
Chris Anderson, for the record, yes, and that's precisely why we drafted in Section 5, there are I apologize. In Section 6, there are a number of data points that must go in to the Cannabis Compliance Board's report to the Legislative Counsel Bureau annually about the number of investigations performed pursuant to this policy, the number of referrals to the Deputy Attorney Generals, to compile charges in a case. a summary of the finding of investigations, cost of the enforcement activities, amounts recovered through civil penalties, and taxes, seizure of currency, and the value of unlicensed cannabis products seized, and a summary of actions taken with regard to the whistleblower section of this bill.
So thank you. I would still don't see demographic and location information in there, but my first question was, in any of these scenarios, if the pop-up is right there, if the store is right there, when the CCB agents or folks go in there, if they can seize, do they shut anything down or do they just walk away and then fine them?
I believe that for the CCB's part, they would, come in, seize products, currency. That, I think, in effect, that kind of shuts it down, at least for the day, and then fines them. It doesn't prevent, law enforcement from getting a tip, potentially from CCB or others, and potentially, doing, whatever enforcement activity they see fit. With regard to the report that's required of the CCB in Section 6, I think that's a really helpful suggestion. I think demographic information would be important for that report. Thank you.
It's Robert Wiley. Can I add to that too?
Yes, please.
So let's say a pop-up shop, one of the illegal sales points, they tend to occur inside warehouses. They tend to occur inside areas, industrial complexes. And just by the very fact that they have that open and are selling marijuana or cannabis, that in itself is a violation and it can be shut down. So just by the act of doing that is already unlawful on the books, and it can be shut down right away. Plus, whoever owns that building, they are the ones responsible for what happens in there, and action can be taken against them as well.
Thank you for that. Our next question is from Assemblywoman Gallant.
Thank you, Chair. Thank you for this presentation. I do know we have an issue with illegal sales here in the state, but I can't help but wonder if we've created this because of the high tax structure, and wondering if you've looked at the cost of doing this versus maybe even lowering the taxes to make it more affordable, so then it would just naturally sort of make the illegal market less desirable, right? If you don't have the demand for it, people can afford to go to the various legal shops, then you're going to have a less illegal market. So have you guys looked at that model, that the cost benefit between doing it both ways?
Chris Anderson, for the record. I think there's a couple of things that drive people to the unlicensed market. It's price, to be sure, but it's also convenience. There's a lot of things that illegal operators can do that the licensed industry can't do. The unlicensed industry can deliver you, cannabis as well as other narcotics straight to your hotel room. The licensed industry can't operate on or near the strip. And so it's just a convenience thing. I would welcome any policy to lower taxes on the industry. As far as comparing that to cost savings in this legislation, it would be very difficult just because the tax revenue is so large. You'd have to cut taxes by a very significant amount in order to for that to be more cost efficient to the state than the cost of carrying out this enforcement. So just to I'll just give an example, sort of back of the napkin. If we lowered tax revenues by, or if we lowered the amount of taxes by, let's say, a third or something, we took the tax rate from, say, 30% to 20%, the state would lose, at least tens of millions of dollars in tax revenue there. But the cost of doing this, and I don't have fiscal notes here, but I'm guessing it's somewhere in maybe the $5 million range, something like that is kind of what a general number that I've heard from the enforcement agencies that would be involved.
Do you have a follow-up, Assemblywoman?
I'll talk to him offline. Thank you.
Okay, thank you. Our next question is from Assemblyman Ornlicker.
Thank you, Chair, and thank you for the presentation. I'm curious about Section 2.1B about the advertisers who allow placement of ads for unlicensed dealers. And just what the context is, I would think we'd already have something like that because this is a problem with alcohol, cigarettes. So is there already some laws about taking advertisements from illicit sellers, or do our laws not deal with the internet, or why do we have this with it? And also with the 10 million, well, the 10 million doesn't apply to the advertiser. So yeah, why do we need this? Isn't there already? And then the other part is you say knowingly. So of course, that encourages people to look, just ignore and not turn a blind eye. So what's the context to make sure this will work?
Chris Anderson for the record. Today, I'm sure it is illegal for, to accept an advertisement from a business that is illegal. This does levy a potential $10 million fine on folks who knowingly accept an advertisement from an unlicensed cannabis operator. So I think this is just a far greater deterrent to enabling unlicensed operators. The term knowingly, I do think it's appropriate. So just, as defined in NRS, knowingly imports a knowledge that facts exist which constitute the act or omission of a crime and does not require knowledge of its unlawfulness. Knowledge of any particular fact may be inferred from the knowledge of such other facts as should put an ordinarily prudent person upon inquiry. So, so for operators, for either landlords or folks who operate, in the digital space where advertising occurs, I think if you're, doing your kind of due diligence and, making best efforts not to allow illegal activities on property that you control, I think you're fine. But when you start, intentionally looking the other way, that's when this section, would apply to you. And you heard from Mr. Whiteley today. Those commercial spaces, industrial buildings, are where a lot of this large pop-up activity is happening. So I think that this additional disincentive to allow that to happen is important.
Thank you. Our next question is from Assemblywoman Hardy.
Thank you, Chair, and thank you for this presentation today. And so I think it's been well established that we have a problem in Nevada with illegal products and illicit, dangerous products, unlicensed people selling these things. And then you have the public that thinks they're going somewhere and buying something that's safe from a licensed provider, and they're not. And so, I appreciate laws and trying to get at that unlicensed, dangerous products for the many reasons stated, people taking it, and then you have devastating consequences from that. So my question kind of is, in all of this discussion, you're able to identify where this is being sold, whether it's on Instagram or they have websites or they've got an actual physical location. And so I guess I'm wondering, like Assemblywoman Cohen, why is a business still open when it's clearly illegal and unlicensed? Is that, something to do with business license division of the counties and cities? Because I think, we can have penalties, we can have all of this, the investigations, but then at some point they need to be shut down And I understand, if it's their pop-ups in warehouses and things like that, that's another scenario. But how can we get to shutting them down? Like, what does that take? If they're on Instagram, like, you can identify who and where they are. How do they, shut them down? Now, granted, they could go get another name and pop up somewhere else, but I think all of this needs to work together so that you're shutting them down. I mean, what other businesses are unlicensed and illegal and are allowed to continue operating? So maybe that's a bigger discussion. But maybe in this report, is it who keeps track of what's being shut down? Could that be included in the report? Or just who is keeping track of that? Is somebody keeping track of what is actually being stopped and shut down? So I know that's a lot, but that's just kind of what I'm hoping can be done, if it is already and being tracked.
Chris Anderson, for the record. I think one of the key problems we have today with effectively conducting enforcement on this unlicensed industry is the fact that there's not really one agency whose job it is to do it. I mean, if everyone has responsibility, then no one has responsibility. And so I think, if you passed AB 413, I think that unlicensed dispensary in Las Vegas that we know about, that would probably be shut down today by virtue of all of their products being yanked by the Cannabis Compliance Board and all of their currency being seized. And so I think that's just one example of a reason to pass this legislation. As far as reporting of what's being the effectiveness of this enforcement, I think we've tried to capture that in Section 6, subsection 11. Very open to adding additional metrics that you as a body would like to see.
Thank you for that. I believe that's the end of questions from members, although I have one last clarifying one. And my pages are all out of order now with this new amendment, but I believe they are really out of order. I'm just going to start at page 4, okay, at the top of page 4. I think it might be section 2, subsection 3, number 2. But the first paragraph in page 4 and here's page 3. Okay, so starting with this section, section 3, it talks about penalties could be issued from or civil action brought by the city attorney, the attorney general, and then in number 2 it talks about or the board as well. So are we saying, and I know we're trying to create grand deterrence, but are we saying that someone could be fined essentially by the city, state, and the board for the same infraction or offense, because it says, or the board shall order the person to pay a civil penalty in that amount in addition to any other civil penalty imposed?
Chris Anderson, for the record. Section 3, that section is with regard to recovery of unpaid taxes.
Okay.
And so obviously the maximum penalty is the amount of your unpaid taxes. So regardless of who brings the action, the fine amount I think would be the same. The city attorney is kind of in this statute already. The city attorneys were given jurisdiction to enforce against the unlicensed market last session by AB 326, and so they're still in this legislation today.
And I'm sorry, I think I'm missing that. Where does it say about the collection and taxes? Because
in section 3, subsection 2, says, if the attorney general, city attorney proves the amount of the excise tax on cannabis for the products would have been liable, had the person engaged in the sale as a licensee, that person is liable for the unpaid taxes.
Okay, so then, in addition to be liable for unpaid taxes, what would the fine from the board be?
Chris Anderson, for the record. The maximum $10 million civil fine is in addition to any unpaid taxes, which will probably, realistically speaking, be the hardest thing to prove. So I think, you're probably going to see, civil penalties congruent with the size of the operation. And, if it's really easy to prove how much product was sold, I think that's when the collection of unpaid taxes comes in. But otherwise, my expectation is that the board will seek primarily the civil penalties.
So typically, and I'm just thinking of personal taxes, if someone doesn't pay or is late on paying their personal taxes, there are additional fines imposed that I understand, but I believe those fines actually come from the federal government, not from another entity. So what you're saying essentially is if the business doesn't pay their taxes, that they would have the fines, but then also the board would issue another fine on top of the whole issue of them not paying their taxes or paying it in full or paying them on time.
Chris Anderson, for the record, that's correct. The state could recover its lost revenues in addition to the civil penalty fine.
Okay, thank you. I think with that, then we are ready to open it up for testimony.
Could I say one more thing to conclude the presentation?
Certainly.
This legislation is the product of a lot of conversations over many months. And so for the folks who gave input, you know who you are. I appreciate you. I want to thank all of my co-presenters and co-workers at Solid Consulting, Esther Badiata, Eva Black, and Bob Whiteley, and also 3 people who specifically gave extremely important insights throughout this process, and that is Lake Martin, the executive director of the NCA, Nevada Cannabis Association, Rihanna Durrett, and Leighton Kohler, who's the general counsel at one of the clients we represent, Planet 13 Holdings. So I wanted to recognize them. Thank you.
Thank you so much for that. With that, then, I will go ahead and open it up for testimony. If there's anyone here in Carson City that would like to testify in support of Assembly Bill 413, please come forward.
Good morning, Chair, members of the committee. For the record, my name is Daniel Stewart. I'm here on behalf of my client, Pisos, which is a licensed cannabis recreational and medicinal operation. We are in strong support of this bill. In the last 8 years or so, I've had a chance to work in and out of government multiple times, and strangely enough, been involved in cannabis policy quite a bit, despite my severe unfamiliarity with the product itself. And this is probably the thorniest issue that has come in front of policymakers. How do we regulate without recriminalizing, I think, is an incredibly difficult line to walk, and I think this bill has done a great job. We, as you know, we are dealing with historic surpluses in a lot of areas of revenue, except for cannabis taxation. It's one of the only revenue sources we have that's actually declined. Large part, I think it's because of the illicit market. When the voters approved legalizing recreational cannabis, it was part of a trade. They got more tax revenue in exchange for legalizing the market, and I feel like this bill honors the will of the voters in that trade. Thank you.
Thank you, Madam Chair. Brett Scolari, Strategies 360 for CPCM Holdings, Cura Cannabis Solutions, Green Mart of Nevada, and Clark Natural Medicinal Solutions. We are in support of AB 13. Anything that can be done to disrupt the illicit market without recriminalizing and the balance that Mr. Stewart talked about, that's what we're trying to achieve this session. I can tell you we're working on a piece on the Senate side that would go along with this. And what it really does is attack that last slide there. And you know, having a civil system for this could end up being kind of a whack-a-mole situation. What you really need to focus on, in our opinion, is the large-scale crimes and criminal organizations that are behind those operators and those unlicensed activities. So if you don't get at the root of the problem, I don't think we're going to make a big dent in that $614 million tax loss. And another piece we're working on, and it goes to Assemblywoman Summers Armstrong's question, is we have an idea to redirect some of the taxes that are being paid by the licensed industry for a public education campaign that would be very aggressive and hit those tourists, hit the public, notify them of the dangers involved with participating in the illicit market, and hopefully that can also make a big dent, because I do agree with the sentiment there that the industry does need to participate in that, and there are tax dollars that could be available for that of those that we're paying already. Thank you.
Thank you.
Good morning, Madam Chair. For the record, Scott Gills with the Griffin Company on behalf of the Nevada Cannabis Association. NCA supports AB 413 as amended as well, as it addresses one of the greatest threats to the licensed cannabis industry. The bill provides tools for meaningful enforcement and additional resources through the recovery of civil penalties. Just want to appreciate the Judiciary Committee for bringing this bill, and Chris Anderson for all his work. I would also note the NCA-sponsored report prepared by Mr. Whiteley. Happy to make that available to you, Madam Chair, or your committee members as needed. And that I would also note in response to the question by Assemblywoman Summers Armstrong, NCA is currently working with the Clark County Commission, particularly, I understand, Commissioner Sager-Bloom, on some sort of education and outreach campaign on this topic. Thank you.
Thank you.
Oh, sorry. Thank you, Chair Miller, members of the Assembly Judiciary Committee. My name is John Jones here on behalf of the Nevada District Attorneys Association in support of AB 413. We do support adding additional tools to go after the illicit illegal marijuana market, and we also believe that the enforcement of this new civil penalty should be at the state level. I want to thank Mr. Anderson for working with us on our concerns and the amendment. Thank you, Chair.
Is there anyone else here in Carson City wishing to come forward and testify in support? Not seeing anyone. Is there anyone there in Las Vegas?
Good morning, Madam Chair. Scott Rutledge, for the record. I'm with our Gentum partners today representing three of our clients, Deep Roots Harvest, Mom's Meds Management, and Green Life Productions. We're here in support of AB 413. Just a couple of things I wanted to note. The illegal market of cannabis looks very much like the regulated market, and so a lot of the products you'll see being sold illegally are products coming from, say, California or Oregon. They're packaged to look like legal products. There are consumers who don't understand that cannabis products from another state are not eligible to be purchased in a state like Nevada, and so they just assume that it could be legal because it looks just like the product you would buy in a retail store. When we passed Question 2 in 2016, the idea of decriminalizing and then legalizing cannabis and setting up a regulated market, the goal here with AB 413, as I see it and as most of my colleagues understand it to be, is we're not trying to recriminalize this market, especially for your low-level offenders. If folks are selling small amounts of cannabis, that's not the issue. The issue are the larger enterprise scale businesses that we have to go after, and we believe that this is one of the solutions that can get us there. So again, just wanted to show up today in support of AB 143. Thank you for your time.
Thank you. Is there anyone else there in Las Vegas? Not seeing any. Broadcasting, will you open the phone lines, please?
To testify in support of Assembly Bill 413, please press *9 now to take your place in the queue. There are no callers choosing to testify in support at this time.
Okay, thank you. Then I will open it up for opposition here in Carson City.
Good morning, Chair Miller and members of the Assembly Judiciary Committee. My name is Jeff Rogan, representing Clark County. We have limited opposition this morning. Our concern was in sections 11 through 13 that would have allowed, after a change in federal law, for cannabis facilities to be included in our airport. That has been fixed by the amendment that's before you, but nonetheless, pursuant to the committee's rules, I'm testifying in opposition. Thank you very much.
Thank you so much for that. Anyone else testifying in opposition here in Carson? In Las Vegas, do we have anyone testifying in opposition of Assembly Bill 413? Not seeing anyone. Broadcasting, is there anyone on the line?
To testify in opposition to Assembly Bill 413, please press star 9 now to take your place in the queue. There are no callers choosing to testify in opposition at this time.
Thank you. So then I will open it up for neutral testimony. If there's anyone here in Carson City that would like to testify in neutral. Not seeing anyone. Is there anyone there in Carson City, in Las Vegas that would like to testify in neutral? Broadcasting, is there anyone on the line that would like to testify in neutral?
To testify in neutral to Assembly Bill 413, please press star 9 now to take your place in the queue. There are no callers choosing to testify in neutral at this time.
Okay, thank you. Then with that, I will welcome the bill presenters back up for any final remarks.
Chris Anderson for the record. I appreciate the time this morning. We appreciate all of the thoughtful questions that have been asked in this committee. I think a couple things that are clear. There's a desire to make sure that, particularly, for our locals and also visitors, that they make sure, to the extent that they don't know that they're purchasing from the unlicensed market, to make that aware. And I think you heard from the industry, and there's a lot of willingness to make sure that that is the case. So we will move forward either with provisions in this bill or other legislation and efforts at the local level to make sure that that is addressed. And to the points made by members of the committee about some additional reporting functions of metrics related to these enforcement actions, I will absolutely pursue some draft language that increases the kind of number of topics that are reported by the Cannabis Compliance Board that come out of the enforcements. Thank you.
Thank you so much.
Robert Whiteley in Las Vegas. Just want to say that, as the situation sits right now, there is zero enforcement going on in the illicit market. The DA's office find that the juries do not convict on criminal charges for marijuana offenses, which causes the DAs to be reluctant to bring cases forward. The fact that the DAs are reluctant to bring cases forward makes it reluctant for Metro to go out and do the investigations because it's time and cost prohibitive if they're not going to get prosecution out of it. So it leaves this vacuum of any type of enforcement going on. So in my view, it's we've got to do something because right now there's just absolutely nothing. And continued on, it'll just continue to grow because the prices that they can sell their illegal product undercuts the legal market by more than half. And that's it.
Thank you so much. With that, I will go ahead and close the hearing on Assembly Bill 413. The last item we have today is public comment. Again, reminding people that you have the opportunity to make public comment, but not on the two bills that we actually heard today, on something else that's under the purview of this committee. So is there anyone here in Carson City that would like to make public comment? Not seeing anyone. Is there anyone there in Las Vegas? Okay, not seeing anyone. Broadcasting, is there anyone on the line?
To provide public comment, please press star 9 now to take your place in the queue.
Anne Marie Grant, ANNEMARIEGRANT. My brother Thomas Purdy was murdered by Reno police in Washoe County Sheriff's Office during a mental health crisis. My brother's voice was stolen by law enforcement in Nevada. He no longer has a physical voice. The dead cannot cry out for justice. Therefore, it is my duty to do so. Silence against injustice, you are aware of, is compliance. 9 years ago yesterday, 4/9/2014, 54-year-old David Lee Kuhn died when his 1997 green Dodge Intrepid flipped and rolled after a pit maneuver by the sheriff of Eureka County at the time, Kenneth E. Jones. David's crime, an alleged illegal left-hand turn leaving the easy stop on Main Street in Eureka. David was a Marine veteran who proudly served his country and survived war, but could not survive a traffic encounter with police. The so-called investigation conducted by Eureka County Sheriff's Office makes no mention of any investigation into Sheriff Jones' use of deadly force. It only mentions the traffic infractions committed by David that he lost his life over. Sadly, David's family had zero information until April of 2022 when I provided them with the dash cam footage I had obtained via a public records request. I'm sure it was hard to watch your father be murdered over a traffic infraction. There was no gun, no high-speed chase, and no need for Sheriff Jones to choose to pit David's vehicle. Imagine having zero information for 8 years, even though his son David had put in a request himself. Shameful. Police investigating themselves has never brought justice for any family in Nevada who has had an unarmed loved one killed by police. Seeing how so many who have been abused by the local Washoe government and the continuous constitutional violations at the Washoe County Jail currently occurring, I'm asking all of you to call on Attorney General Ford to open an investigation into the pattern and practice of constitutional violations at the Washoe County Jail. When I see elected officials simply moving on, knowing full well that by doing so makes progressively worse for others, moving forward, it's disheartening. Thank you.
Thank you. Next caller.
There are no other callers to provide public comment at this time.
Okay, so with that, I will go ahead and close public comment. We have finished all of our business on our agenda today. So before we adjourn, just reminding folks that I'll see you back at 8 a.m. tomorrow morning. This meeting is adjourned.